Hello, everybody. Welcome to our podcast, BIA for You, for Them, a platform where our physician experts talk to all of us and share with us credible information about different heart conditions, one condition every month. This month, I have the pleasure and honor of welcoming Dr. Laurence Sperling, who is the Katz Professor in Preventive Cardiology. He's the founder, Emory Center for Heart Disease Prevention, Professor of Global Health, Huber Department of Global Health, Rollins School of Public Health at Emory University. He is the CMO for the Family Heart Foundation, dedicated his profession and his career for prevention of cardiovascular disease among patients and at a public health level overall. Dr. Sperling, what an honor to have you today. Thank you for taking the time.
Yeah, thank you, Dr. Sareen, and what an honor it is to be with you today. I know we've become good friends and colleagues through our work in heart disease care, and I know you're a champion for many things, especially heart disease in women, and so glad to join you and your listeners today.
Thank you. Thank you, Dr. Sperling. Means a lot coming from you. I wanted to open up this dialogue with you, given your expertise, about what are your thoughts about genetic cholesterol disorders? What do you want our listeners to know about it today in 2025?
Yeah, thank you. So before we get into genetic cholesterol disorders, our recording here is the very end of February, which is American Heart Month. And although we dedicate a month to heart disease awareness and knowledge and treatment, I say every single day should be a heart disease prevention day. And then February is also Black History Month, but we're rolling quickly into Women's History Month, which will be relevant in our discussion. And also, it is lipoprotein(a) Awareness Month. So one of my goals will be for your listeners to better understand what is lipoprotein(a), because it is something many people are not aware of, including many doctors. And since 2021, there's actually an Lp(a) Awareness Day. It's March the 24th. So now we come back to genetic cholesterol disorders. When we're born, each and every one of us get a deck of cards. Those are our genes. And we don't always play those cards. Some of them we, keep in our deck throughout our whole life. And many things can impact whether the genes or cards are played in our life. But there are cards in some of our decks that code for genetic cholesterol problems. And these are conditions that are more common than we might imagine. I'm only going to talk about two today because these are two critically important conditions for your listeners to be aware of. The first is called familial hypercholesterolemia, or FH. We see this in 1 out of every 250 people worldwide, men and women, all ethnicities. And it's a disorder that greatly increases the likelihood of having a heart attack or stroke at a young age. The good news is it can be detected in an early age, but many people living with familial hypercholesterolemia are unaware, even when they're seeing their doctors. So a simple equation I like to use, and I definitely was not a math major, but it's F plus H equals FH. So if you have a family history of early heart disease, a family history of high cholesterol, and you yourself are found to have a high cholesterol, there's a chance this could be genetic. Now let's move to lipoprotein(a). That's a mouthful. This is a cholesterol-related particle, and I call it a cholesterol particle with an exclamation point because it's a triple threat. It increases the likelihood of plaque developing in our arteries, increases the likelihood of inflammation, which leads to the risk for heart disease over time, sometimes acutely, and increases the likelihood of our blood vessels getting sticky or developing blood clots. Lp(a) is a genetic disorder that is seen in 1 out of every 5 people worldwide. And most people are completely unaware, and many clinicians are completely unaware of Lpid as a potent heart risk factor.
That is very well described, Dr. Sperling. I couldn't imagine a better description. And lipoprotein A is definitely not as checked as often. I do not know if all the labs even offer this testing, but we haven't seen it as much as LDL in our patient population. What do you suggest is the right time to be tested? And does everybody get tested once? There are certain people who should get tested, and how many times in their lifetime?
Yeah, first we'll just talk about being aware of your cholesterol level in general. Our pediatric guidelines recommend that all children in America should have a cholesterol test between the ages of 9 and 11. Unfortunately, only 10% of children are getting their cholesterol checked during that window, but children with a family history of early heart disease or a family history of high cholesterol should be checked as early as possible because this is a genetic condition. And not only will it be evident literally at birth or during the first year, but the sooner we can detect it, the sooner we can treat it, the sooner we can make a difference in the life of our children and people we love. Now, as far as lipoprotein little a, in general, here we recommend testing people who have an history of aggressive early heart disease, but we also want to dial back to primary prevention before people have heart disease. So if there's a family history of heart disease, lipoprotein delay also increases the likelihood of aortic stenosis, a valvular problem where the valve gets stiff or stuck. Now, in general, it's probably worthwhile for most people to be aware of their lipoprotein delay. In other countries, this is more of a guideline. In Canada and in Europe, the recommendations are for each and every adult to have their lipoprotein delay checked once in their life.
Wow, that is an extremely important piece of information. And if we do lipoprotein A is checked and we find that it's abnormal, what do we do? What should our listeners do?
Yeah, so your listeners, first of all, should feel empowered to ask their doctors about measuring their LP little a in addition to a general cholesterol profile. But if your LP little a is elevated, it provides important awareness of potential risk, potential higher risk. You also should inform your family because it can run in families. It's a genetic disorder. And so the medical term is called cascade screening, but it's, having your brothers and sisters checked, your children checked, maybe your aunts, uncles, cousins, etc., especially if there's that strong family history of early heart disease. If you do have an elevated lipoprotein delay, first and foremost, it's important to look at all of your other heart risk factors, make sure those are being addressed adequately and aggressively. And we often want to begin cholesterol therapies in a high-risk person with a elevated lipoprotein delay. The exciting thing is there are potential medications on the horizon. And actually, the first study looking at Lp(a) directed therapies is called the Horizon trial. And we may have an answer to that in the next year or year and a half. So for people with elevated lipoprotein(a), there may be specific treatments for people that have very high lipoprotein(a) or continue to have heart problems despite optimal therapy. We can use a very unique therapy called lipoprotein apheresis. And I describe this as kind of washing the cholesterol out of the blood periodically. And for many people, this can greatly lower their chances of having further heart problems.
Thank you, Dr. Sperling. Again, it's really important to advocate and make sure we get checked, especially if there's family history. Once we find a prevention and making sure we aggressively change our lifestyle is really important. As Dr. Sperling alluded to, at this time, there's really no effective treatment, but there are other therapies that are coming up, and hopefully we'll have some answers soon. Dr. Sperling, thank you for taking the time. Are there any final words you want to tell our listeners?
Yeah, I think a couple of things I'd like to just point out. Elevated lipoprotein(a) is seen more commonly in women and Black people. women also after their menopausal years can have a higher Lp(a) than before and even a higher cholesterol. So, during that transition in life, it's important to check back in with your doctor about your heart risk. Lastly, we can save generations of families from heart attacks and strokes by being aware of these genetic risk factors. And the Family Heart Foundation has a free kit available that you can order. It's called Cholesterol Connect. It will be mailed to your house, and by a finger stick blood test, you can find out your cholesterol and your lipoprotein(a) level. The Family Heart Foundation has expertise that focuses on moving research to clinical practice, advocacy, and education with very specialized care navigators that can help people with questions free of charge.
Thank you, Dr. Sperling. Again, we are so appreciative of all this information, not just about the risk factors, what lipoprotein A or genetic cholesterol disorders are, but also what we can do to prevent it and to treat it effectively. We appreciate your time. Thank you, everybody, for being here. Again, thank you, Dr. Sperling, for taking the time and talking to us. Every time I talk with you, I learn something new. So it's always exciting. And if we have any more questions, what we should talk about next month, please email us at biayourselfcontact@gmail.com. Until then, have a great month. Thank you, Dr. Sperling.
Yeah, thanks.